So we know now, as I've been to the meetings in San Diego, the California Academy of Cosmetic Surgery and the American Academy of Cosmetic Surgery in cold Tampa, Florida, just last week, and attending the breast sessions there, that there is absolutely a trend with women going to smaller implants, or what we call the ballerina breast augmentation. And we actually just had a show a week or two ago here on KSRO. So go to YouTube, and it'll be under the heading of ballerina breast augmentation, and you can listen to all the details about that. But just in short summary, there has been now a trend where women want what I'm going to say, a more slender look. They want to be augmented, they want fullness, but they don't want a heavier breast image. And so for those women, we are now offering the ballerina breast augmentation, which again is done under local anesthesia, where we're taking smaller implants. And again, it's relative to how small or large the woman is. But if you want an actual number of the size of the implant, we're probably looking at anywhere from 125 cc's, maybe up to 250, 275 cc's, maybe up to 300 cc's, where the patient wants a modest enlargement. Okay, they like the more lithe, L-I-T-H-E, the lithe look. And so what we would do is we do a consultation once again. The important parameters are to see how much of your own soft tissue you have. It's called a superior pinch test. We use little calipers and we measure how much at about the underarm area, and we look and see how much breast tissue does a woman have in that area, or fat in that area in terms of coverage. The difference with our ballerina breast augmentation, because they are smaller implants, is that we like to preserve the function and not interfere with your chest muscles called the pecs, or the pectoralis major muscle. So all of us kind of, from working out at the gym, we're like, we're going to build on our pecs. At least guys will talk about that. Women probably do as well. But traditionally, when you do breast augmentation, probably I'm going to say 85% of the time in my patient population, we are putting an implant underneath that muscle. So if you have a muscle like this, what we do is we take an implant and we put it underneath the muscle. And so what that does is it protects the upper portion of the implant from being seen. And that's a submuscular approach. With the ballerina breast augmentation, because we're going smaller, we're not getting as much expansion beyond the natural boundaries of the woman's breast tissue, her own breast tissue. What we do is, through a tiny little incision, is we'll go and stay on top of the muscle, and there is a little layer of tissue, connective tissue, called the fascia. And so I just make a little incision on that fascia, and we elevate the fascia up for the pocket to kind of protect the implant, as well as the breast tissue and the skin. And we place that implant on top of the muscle, but below the muscle fascia. So the muscle is left intact. The muscle is left intact. And by putting this smaller implant in, we can give the woman nice fullness. A lot of times it's just beautiful for rounding out the figure, especially in thinner athletic women. They like this look. And most ladies are very, very happy with this. So if you think that you are interested in the ballerina breast augmentation, you're looking for a modest increase in size, you like kind of a more slender athletic look, then please give us a call and speak with Karina, our surgical liaison, and we would be happy to evaluate you to see if the ballerina breast augmentation is appropriate for you. So the keys, why would you consider that? One, you don't want to go too big. You like a more modest athletic look. And also you can appreciate the benefits of leaving your chest muscle, the pectoralis major muscles, intact. So for those who are interested in the ballerina breast augmentation, please give us a call. Go to YouTube, and we'll have a whole video, a whole half-hour video on that for you on our Ask the Expert KSRO show. It's under Dr. Walter Tom on YouTube. So